1. A 65-year-old male presents with sudden onset of severe chest pain radiating to the back. His blood pressure is significantly higher in the right arm than the left. Which condition is most likely? A. Myocardial infarction. B. Aortic dissection. C. Pulmonary embolism. D. Pericarditis. Two. Which of the following is a contraindication for metformin use in a patient with type 2 diabetes? A. BMI greater than 30. B. Creatinine clearance less than 30 milliliters per minute. C. Hypertension. D. Hyperlipidemia. 3. Which antibiotic is the best choice for treating community-acquired pneumonia in an adult without comorbidities? A. Azithromycin. B. Ciprofloxacin. C. Amoxicillin clavulinate. D. Vancomycin. 4. A patient with atrial fibrillation is at high risk for stroke. Which medication is most appropriate for stroke prevention? A. Aspirin. B. Clopidogrel. C. Warfarin. D. Amiodarone. 5. A 45-year-old female presents with fatigue, hair loss, and cold intolerance. TSH is elevated, T4 is low. What is the diagnosis? A. Hyperthyroidism. B. Hypothyroidism. C. Subclinical hypothyroidism. D. Euthyroid 6 syndrome. Six. Which medication is first line for hypertension in a patient with diabetes? A. Beta blocker. B. ACE inhibitor. C. Thiazide diuretic. D. Calcium channel blocker. Seven. What is the recommended screening test for colorectal cancer starting at age 50? A. Colonoscopy every 10 years. B. FOBT every year. C. Flexible sigmoidoscopy every 5 years. D. Capsule endoscopy. Eight. Which medication should be avoided in a patient with a history of peptic ulcer disease? A. Acetaminophen. B. Naproxen. C. Gabapentin. D. Metoprolol. 9. A patient presents with a painless ulcer on the genital area. What is the most likely cause? A. Herpes simplex virus. B. Syphilis. C. Chlamydia. D. Gonorrhea. In asthma management, which medication is used for immediate relief during an acute attack? A. Inhaled corticosteroid. B. Long-acting beta agonist. C. Short-acting beta agonist or SABA. D. Leukotriene receptor antagonist. What is the first-line treatment for generalized anxiety disorder? A. Benzodiazepines. B. SSRIs. C. Beta blockers. D. MAO inhibitors. Which of the following findings is most concerning for melanoma? A. Symmetrical border. B. Uniform color. C. Diameter greater than 6 mm. D. Flat surface. A 70-year-old male with COPD is at risk of osteoporosis. What is the best preventive strategy? A. Calcium and vitamin D supplements. B. Bisphosphonates. C. Weight-bearing exercise only. D. Smoking cessation only. A patient with heart failure and reduced ejection fraction should avoid which medication? A. ACE inhibitor. B. Beta blocker. C. Non-dihydropyridine calcium channel blocker, for example, diltiazem. D. Diuretics. Which vaccine is recommended annually for all adults? A. Influenza vaccine. B. Tdap booster. C. Pneumococcal vaccine. D. Hepatitis B vaccine. In managing chronic kidney disease, which dietary restriction is most important? A. Protein restriction. B. Carbohydrate restriction. C. Fat restriction. D. Fiber restriction. What is the most common cause of hyperthyroidism? A. Graves' disease. B. Hashimoto's thyroiditis. C. Toxic adenoma. D. Thyroid cancer. Which drug class is first line for treating hyperlipidemia? A. Statins. B. Fibrates. C. Niacin. D. Bile acid sequestrants. Which type of incontinence is characterized by involuntary urine loss due to increased abdominal pressure? A. Stress incontinence. B. Urge incontinence. C. Overflow incontinence. D. Functional incontinence. 20. The most appropriate test for diagnosing osteoporosis is A. Serum calcium. B. DEXA scan. C. X-ray. D. Bone biopsy. Which symptom is most characteristic of Parkinson's disease? A. Intention tremor. B. Resting tremor. C. Spasticity. D. Hyperreflexia. A 30-year-old woman presents with unilateral headache, nausea, and photophobia. What is the most likely diagnosis? A. Tension headache. B. Cluster headache. C. Migraine. D. Temporal arteritis. Which of the following is a diagnostic criterion for metabolic syndrome? A. Elevated HDL. B. Increased waist circumference. C. Low fasting glucose. D. Low triglycerides. AANP. The American Association of Nurse Practitioners, or AANP, is the largest professional membership organization for nurse practitioners, or NPs, in the United States, representing over 121,000 members. Founded in 1985, AANP advocates for the recognition and advancement of nurse practitioners as leaders in primary, acute, and specialty care. The organization focuses on promoting high-quality, accessible healthcare by supporting NPs through continuing education, research, and policy advocacy. AANP also offers national certification programs, clinical resources, and opportunities for professional development to enhance the skills and knowledge of its members. By advancing legislative and regulatory policies, AANP aims to remove barriers to practice, allowing NPs to work to the full extent of their education and training, ultimately improving patient outcomes and expanding access to care. Here are 5 top beneficial uses of AANP. 1. Advocacy and policy influence. AANP actively advocates for policies that expand the scope of practice for nurse practitioners, or NPs, ensuring they can provide care to the full extent of their education and training. This includes influencing legislation to reduce practice barriers and improve healthcare access for patients nationwide. 2. Certification and professional development. AANP offers national certification programs and a wide range of continuing education, or CE, opportunities to help NPs maintain licensure and stay updated with the latest medical advancements. This supports NPs in providing high-quality care and enhances their clinical expertise. 3. Clinical resources and research. The organization provides access to evidence-based clinical resources, guidelines, and research publications that assist NPs in making informed decisions in practice. These resources cover various specialties, helping NPs deliver the best possible care across diverse patient populations. 4. Networking and community support. AANP facilitates networking through conferences, local chapters, and special interest groups, allowing NPs to connect, share knowledge, and collaborate. This community support fosters professional relationships and mentorship opportunities, enhancing career growth. 5. Discounts and financial benefits. Members of AANP gain access to exclusive discounts on certifications, insurance, CE courses, and professional tools, reducing the financial burden on NPs. These benefits help make continuous learning and practice resources more affordable,